Hey everyone, welcome back to my channel. Thanks for joining me today. I am so excited to show you a microblading procedure. So microblading is where we make fine little superficial paper cut type scratches into the skin. Pigment settles into those little cuts, skin heals over top, and locks in the look of little fine hair-like strokes. So this client had normal to dry skin. She had a decent brow shape, just wanted a little more structure and shape to them. So we decided microblading was the best fit for her. And I always use nano blades in my practice. So enjoy watching this tutorial and seeing how we gave her the look of microbladed eyebrows. Okay, so we're gonna get ready to do our first set of strokes. So you wanna load your needle tip with some ink. So when I put it down into the cup, I just kind of dip the toes in. You want it about halfway up, or not quite. I would say maybe a third of the way up the needle. That's good for one stroke. If you get too much on, like that, then you might end up with just really blurry blobs and it's gonna block your line of vision. So I like to have 1/3 to 1/2. You wanna make sure all needles are dipped into that ink, and that's a really good amount right there. The client is nice and numb and mapped out, so I'm going to go ahead with my first stroke. So I always let my clients know eyes open, eyes closed does not matter to me, so whatever's comfortable for you. I'm going to start right here on this side. We can chat whatever you want, but I'm just going to have you feel this first stroke. So you're going to want that nice three-way stretch. So I'm going to pull up, pull down, and I use my pinky to stretch as well. So you want that nice three-way strop, okay? How did that feel?
I didn't really feel it.
Good, perfect. So she's nice and numb, which I thought she would be. And then we're gonna go with our next stroke. So again, I'm gonna always make sure I have that nice three-way stretch. And this time I'm gonna stagger this one up a little higher. Good. Feels okay?
Yep.
Can you just let me know if anything changes?
Okay.
This one, I'm gonna go back down to the baseline. And I'm going to pull it up and over. And I'm going to keep doing this pattern throughout the brow. Now, a lot of times people will ask me what the transition point is when I'm microblading for the hair strokes. I really just go with the client's hair. So you can see how her hairs like to kind of come up and over. Right around the arch is where they start to transition to going sideways. And then right after the arch, they start to kind of come down. So that's the pattern that I'm going to follow. And each stroke does not have to come all the way up. So when you look at someone's hair growth pattern, they don't have half-inch long hairs everywhere. So I like to be able to stagger my strokes and place them where needed, going with the hair. So I'll usually work along the bottom, and then I'll come along through the top. Now, you can see a little bit of bleeding here on this fourth stroke. That's a good amount. You don't want really any more than that, but you do want to see some pinpoint bleeding like that so that you know that you're in the right depth of skin. So we're going to try to demonstrate the sound that the client will hear. It's kind of sounds almost like Velcro, and I always like to reassure the client that it's not their skin ripping. It's just the sound of the needles gliding through the skin against my stretch, kind of like if you run your fingers along a comb. So again, I'm going to use this to kind of push her brow hairs out of the way so I can really see what I've done. Now what I'm going to do is kind of go in between the bottom strokes that I've done, and I'm just going to pull up and over because we're just going to create the top line of that brow. Notice how I'm using the needle occasionally to even move her hairs out of the way. I always say make sure every stroke has intention. You don't want to put in a stroke and you're not confident where it's going or what purpose it has in the brow. You want to make sure every eyebrow stroke has a purpose. Okay, so we got our first set of strokes in. So I'm just going to take some secondary numbing on a Q-tip, and we're just going to literally work it in there. If you just pat it on top without working it in, then that pigment will actually block it from absorbing into the skin. So you definitely want to work it in with a Q-tip. And then to prevent that from drying out, I'm just going to use our little saran wrap over the brow. And we're just going to let that cook while we do the next side. You're going to notice that I'm moving my body position and I'm moving my chair around the bed to get at a good angle, because you always want to make sure you're pulling those strokes towards you. You don't want to be kind of trying to go at an angle like this. Always curving those strokes towards you. How's that feeling on this side?
It's good.
Sometimes people will have one more sensitive side than the other. So I always like to be doing check-ins with them. So setting all those toes down, pulling towards you while curving your fingers to create that nice curvature of the stroke without tearing the skin. And always have your clients working for you. So if you need them to turn their head for you, don't be afraid to ask them. And on this side, when I do my stretch, again, I'm still using my left hand to pull up, I'm putting a stretch down here. I'm using my pinky to stabilize here. Okay, so I brush the hairs out of the way. I'm going right in between my strokes, just making the top half of the eyebrow. Okay, so again, we're going to put our secondary numbing in, working it in, and we're going to see what we have on the other side. So I like to wrap my baby wipe in my finger, and then I can really get a good clean up. A brow is born. All right, so you can see those red Sharpie dots are still there too. So one more pass, those won't be there anymore. So like I said, if you're new at this and you're worried about losing your outline, because it's going to take you some time to learn that sweet spot, then the red Sharpies might be the way to go. And now I'm just going to look through here and check my strokes. People ask how many passes we need to do, and I say it's really going to depend on your depth, because some strokes I've done might not need a second pass, some might need 2, maybe 3. So I don't do a general blanket statement of how many passes, because it's really just going to depend on each stroke. So when I'm looking at the strokes, I put just a gentle pressure and kind of pull that skin apart, and you can see in there that the bottom of those strokes are perfect. That's our sweet spot. I don't want to go any deeper. I'm really happy with those. I'm going to run my needle through gently, not putting any pressure so that I don't deepen those strokes. And I'm just going to add a tiny bit of pressure at the top because we want to keep them nice and wispy. And then you can see this stroke. These 2 strokes here are ones that I'm going to want to do a second pass. So they're almost there. I'm not going to use a ton of pressure, but I just feel like they're just not quite deep enough, and if I were to leave them like that, then there's a good chance that they're still too high in the epidermis. They haven't really touched that toe into the dermis yet, and they're just going to shed off in a few weeks. I feel those strokes will just need a gentle second pass. Not a lot of pressure, but we do want to put a little bit more pigment in there and just a smidge deeper. We've done our second pass. There's a little more bleeding, still not tons, but we do want to see that pinpoint bleeding, but obviously I've gone a little deeper in some areas, so we're seeing a little more than the first time. And now I'm going to put that secondary numbing on. And I like to mix it with the pigment because it's almost like a little mini pigment mask. And we're going to let that sit for a few minutes. And we'll work on the other side. So we're going to see what we got from that first pass. Amazing. So you can still see some of those red Sharpie dots. And again, I'm just going to do a really light second pass. What you're seeing down here, this is probably enough on that stroke. We're right below my finger. So I'm not going to do a second pass over that one. But the one next to it is a little softer. So I'm going to do a second pass on that one. So I really look at my passes on a case-by-case basis because I don't want to go too deep and I don't want to stay too shallow. So you always kind of see how the skin is reacting before we go in and finish them up. That's still feeling okay? Yep. And I'm going to put a little stroke in between these two. I just find there's a little bit of a gap there. So I'm just starting down, kind of branching off the second stroke and bringing that up. And some of the pinpoint bleeding you're seeing is just from the first pass. There's actually just from me wiping it off and putting some pressure, you're seeing a little more bleeding. Okay. Second pass is done. One more numbing. What I'm going to do is I'm going to let this sit just for a couple minutes and then I'm going to wipe off the numbing with the pigment and I'm going to set her up for a little seated symmetry check because we're actually almost done and I just want to make sure if there's any little fine details, any fine tuning, any little spots we need to fill in that we're able to do that before we're totally done and she sits up and then we have to go back in. So we also want to minimize the time we're working on the skin because we don't want to cause any unnecessary trauma by overworking and going back in and in again, in and again. So we just want to make sure that we, like I said, are going in with intention. 1-2 passes per stroke, 3 if you need it, and just getting it done as efficiently as possible for the sake of the skin. Okay, so we can see already there's even more definition than that first pass. So I'm not going to do anything to these strokes just yet. I'm going to wait till this side has a bit more time to numb and then we're going to sit her up for a symmetry check. I do like to take our little spoolie and just gently comb the hair. You want to make sure with the spoolie that you're not scratching the skin or scratching into those strokes. So I'm really gently just pushing her hair where it naturally likes to fall to see if there's any little gaps or anything that we need to fill in with an extra stroke. So from here it's looking good, but things always look so different when you're sitting up. So we're gonna wait and sit her up in just a minute or two. So I'm just doing a seated symmetry check, but this is for me, not for the client. So I'm not showing them yet. I'm not ready to reveal that brow. I'm just having a look to see if there's any asymmetries that I see right off the hop. And I can see a couple little spots. So what I've done is I've dipped my needle in some ink. I'm not actually doing anything or breaking the skin, but I am using this like my paintbrush just to kind of mark out where I want to go, because if you were to use a pencil to mark anything out, it would automatically have to go in the garbage. And I also don't want to contaminate the area with anything. So I'm just using some of the pigment from her cup on my needle to see if that's kind of what completes it for me. If I feel like something's kind of off and I dot it out and say, no, that's too much, or that's not what was missing, then I know that I don't want to go there. So again, always doing your strokes with intention. So I can see a couple little spots here that I want to just darken a little bit. Can you do that mad face for me again? Okay, good. And a surprise face. Perfect. Okay, you can relax, and you're going to have you lay back down for one more mini pass. Okay. So now that we've done our last little mini pass, I'm going to take just pigment alone. There's no numbing on her yet because she's pretty numb right now. She shouldn't need it. And I'm just going to massage that into our strokes and let it just kind of hang out in there, fill up. So this is called our pigment mask or pigment bath. This part might be a little stingy. I always warn the clients because it is, there is rubbing alcohol in a lot of these pigment bases. So because of that, it might be a little stingy, but it shouldn't be anything too bad. So we're going to let that sit for just a few minutes. And then we're going to sit her up for the reveal. Okay, you ready to see them?
Yeah.
All right, have a look at the mirror.
Oh, wow.
Like them. How do you like them?
They look really good.
Are you feeling overwhelmed? Are you feeling good?
They're a little bit dark, but
and they will be because you're not used to it, right?
Yeah.
And they are going to look even darker tomorrow.
Yeah.
So I always say no panicking allowed. If you need reassurance, always just give us a call. But
Okay.
They are going to feel like a lot,
Yeah.
especially for the first few days. Because you did have a kind of a bolder brow to begin with, too, right?
Yeah.
But just keep in mind, once they fade, they're going to look super natural. They're going to calm down a ton.
I love them.
Good.
Oh, they look so good.